Hi everyone, welcome back to this short tutorial on SGLT-2 inhibitors from ilovepharmacology. So what is SGLT-2 inhibitors? They are the sodium glucose linked transporter 2 inhibitors. So what is the mechanism of action of SGLT-2 inhibitors? So usually this SGLT-2 is present in the proximal convoluted tubule. They promote the glucose excretion into the urine, thereby they reduces the blood glucose levels. So thereby excreting the glucose from the urine, so they help in reducing the concentration of the circulating glucose. So what are the examples for SGLT2 inhibitors? We have canagliflozin, we have dapagliflozin, we have empagliflozin. These are the examples. So all these SGLT2 inhibitors, they are ending with the gliflozins. So coming to the specific mechanism of action, these drugs bind to the renal proximal tubules where the SGLT2 transporter is present. That is, the sodium glucose linked transporter is present in the renal proximal tubule, which is responsible for the absorption of the sodium as well as the glucose into the body. So by inhibiting the sodium glucose linked transporter, you are not allowing the absorption of the glucose as well as the sodium through this transporter system. Thereby what happens? You are promoting the glucose excretion into the urine, along with sodium will also be excreted out. So once the glucose is coming out of the urine, the tract will be highly infectious because the urine is producing glycosuria, that is, glucose is coming out in the form of urine. The glucosuria is associated with an osmotic diuresis. That means it also brings the sodium. Whenever sodium is driven out, the water will also be driven out. So that's why it causes osmotic diuresis and salt excretion as well. When we talk about the absorption, it gets rapidly absorbed and the time to peak plasma concentration is less than 2 hours. And they are highly bound to the plasma protein. More than 80% of the SGLT2 inhibitors are plasma protein bound. So what are the uses? As usual, they are used in the treatment of type 2 diabetes mellitus. Either they can be used alone or in combination with the metformin if the other drugs are not working properly, or in combination you can give with insulin or other oral glucose lowering therapies as well. So what are the adverse effects? The very specific important adverse effects of SGLT2 inhibitor is, since glucose is excreted through the urine, the patients will be at significant increased risk of getting urinary tract infection and fungal infections, especially the candidal vaginitis and the balanitis. Apart from that, they are also more susceptible for diabetic ketoacidosis, and also since it causes osmotic diuresis and the salt excretion, it can cause volume depletion, and apart from that, it can also increase the risk of fractures on long-term administration, and also it can lead to acute renal impairment and lower limb amputation. So this was about the SGLT2 inhibitor, and SGLT2 inhibitors are also used in the treatment of nowadays cardiovascular condition. They are used in heart failure as well. Dapagliflozin, empagliflozin has been tried and they are proven in reducing the cardiovascular complication. They increase the survival rate and they decrease the cardiac remodeling ability. So SGLT2, they have a dual benefit in terms of treating diabetes as well as in treating the cardiovascular conditions. The one specific side effects which you need to remember is they have increased risk of urinary tract infection, as its primary goal or the mechanism is to excrete the glucose through the urine, which is responsible for risk of urinary tract infection. Thank you.